Top Med Talk.
So welcome back to EBPOM USA. It's day 3 of the first perioperative practicum. We're coming to you live from Atlanta in Georgia. I'm Monty Mythen. I'm joined by my co-host Desiree Chappell. We're going to have a quick recap on yesterday and look forward to today.
Yeah, good morning, Monty. And it's been a phenomenal meeting over the course of the weekend, and yesterday was everything that we thought it was going to be and excited about. We've had some lively conversations with Mike Grocott-Denny about prehabilitation and pre-op optimization for our patients, and a really moving discussion with Paul Wishmeyer last night, and with his experiences with addiction and some of those things. It was very moving, actually.
So that was very, I mean, I've talked to Paul a bit about that before, but that's very, very sobering, isn't it? And the recognition that it can happen to all of us, and the fact that we must be prepared to say it to each other and reflect on ourselves and seek help if we do. Now, this morning, one of the big sessions we're going to have is how to help patients who are, for one reason or another, on opioids long term. I mean, for a significant number of patients, they're still on them because things hurt, and the hurt won't go away, and therefore it's a necessary part of their recovery process and their surgery. So in where you work, do you have specialist services to support those people?
No, unfortunately we don't, and it's probably part of the reason that we are struggling so much in our area of the country is that there aren't a lot of support services for those patients, and we have high rates of Oxycontin use, or we had high rates of Oxycontin use in our state, and which kind of from chronic pain. We do have some pain management specialists, but I think what we're trying to do in the conversation we're having in our particular institution is how we work with those people in the long term.
So if those of you who have listened to this podcast, you've still got a chance to log on to the live stream. Yeah. So if you log on to the live stream today, you'll get a chance to hear the 3 major sessions today. One of them is the pain clinic, another one is the smoking cessation program, and the third one, which we pick up in the afternoon, is the obstructive sleep apnea clinic. Now, do you have smoking cessation programs where you work? Because in the UK, to be fair, it's become fairly standard that if you go to your family doctor, there's a pretty direct route into support to try and stop smoking.
Another piece of the puzzle that we don't have, and that we need in our state, we still have a high percentage of patients that are smoking. So, and I think that's pretty standard across the U.S. I don't think a lot of people are quite moved to that yet. So it's a novel idea that we're discussing today.
So that'll come down to, is it cost effective? So that'll be part of it, because we know it's really hard to give these things up. But we believe it's highly cost effective to give it up on a population health basis. So I really look forward to, I mean, it's there in the program, because I believe we're going to hear a compelling presentation that Duke's been convinced that it is value for money, good for the patient, but also cost effective. And then the final one is the obstructive sleep apnea. Do you routinely evaluate patients for obstructive sleep apnea? We
do, and it's one of the things that it kind of goes in flux. Sometimes we talk a lot about it, and sometimes we don't. Since we started a real push with opioids and looking at how we treat that, we talk a lot more about OSA, obstructive sleep apnea. So I'm really actually excited to hear what Dr. Spector has to say.
Do you routinely record a score? There's a sort of stop-bang score.
The stop-bang score, yeah.
Is that routinely recorded in everyone, or is it sometimes people remember to ask and sometimes people don't?
Compliance with that is not always great, but it's one of the things that we do try and screen for you.
Do you commonly see people bringing their systems in with them, and you let them put them on in PACU and stuff?
Yeah, all of our patients that go through PAT are pre-admission testing. If they've been diagnosed with OSA and they have a CPAP, then they're required to bring it in with them, and as soon as they hit PACU, we hook them up if they're sleepy, and they take it with them through the rest of the surgical journey in the hospital.
Great. Well, we better dive in there and listen to it. So for those of you, don't forget, if you want to listen to the live stream, go to our website, www.topmedtalk.com, and please don't forget to connect with us via all of our different social media platforms. Desiree, remind us of all these great places you can find us.
Oh, Twitter, LinkedIn, Instagram, Facebook. We're kind of on all of them. Topmedtalk.com.
Great. Okay, folks, see you later.
Top Med Talk.